Hello. I would like to thank JACS for giving us the opportunity to highlight our work evaluating long-term outcomes in breast cancer patients with advanced nodal involvement who receive trimodal therapy. Our study evaluated 521 patients with median follow-up of 61 months. The rate of overall pathologic complete response, or PCR, was 19.4%. 34.2% were found to have nodal PCR. Event-free survival at 5 years was 75.1%. The rate of local recurrence was 6.7%, and the rate of distant recurrence was 29.4%. Multivariate analysis showed triple negative disease was predictive of worse event-free survival, while clinical N2 status and achieving overall PCR was predictive of improved event-free survival. Kaplan-Meier analysis showed that patients with HER2-positive disease had improved event-free survival compared to those with HER2-negative receptor types, and patients with nodal PCR had better event-free survival compared with those with residual nodal disease, regardless of disease response in the breast. The 5-year overall survival rate for our patient cohort was 77.2%. Multivariate analysis showed that triple-positive receptor type and achieving PCR to be predictive of improved overall survival. Kaplan-Meier analysis demonstrated that patients with HER2-positive disease had improved survival compared with other tumor receptor types, such as hormone receptor-positive HER2-negative disease, which historically has been associated with better prognosis. When stratified by tumor response, patients with overall axillary PCR had improved survival when compared with those with residual disease in the nodes, regardless of response in the breast. Our study of patients with advanced nodal disease showed that 34% achieved nodal PCR following neoadjuvant systemic therapy. This finding underscores the need for prospective studies to evaluate the potential role of de-escalating axillary surgery in patients with advanced nodal disease. The key focus of such studies would be to develop reliable methods for identifying patients who are likely to achieve nodal PCR, as this information can help guide treatment decisions and potentially spare patients the morbidity of axillary dissection. We also found that HER2-positive status was associated with improved overall event-free survival, which is likely attributed to the use of novel HER2-targeted therapies. Interestingly, our study also showed hormone receptor-positive disease to be associated with worse outcomes, likely due to having luminal B classification. Finally, our study showed that achieving nodal PCR, regardless of response in the breast, was associated with improved overall event-free survival in patients with clinical N2 or N3 disease. Thus, nodal burden after neoadjuvant therapy seems to be the main driver of long-term prognosis. Thank you.